Hello, I'm David James. I'm a paediatric emergency medicine consultant in Southampton and the emergency care lead for Healthier Together. Today we're going to talk about earache and the remote assessment of children and young people whose families call up about earache. The pathway for this can be found on Healthier Together under professionals, GP primary care staff, clinical pathways, and into the list here in selecting earache. Now this pathway is for use for GPs, for advanced clinical practitioners working in primary care, or those working as clinicians on 111. And you'll see it shares a structure with the other pathways, if you've looked at them already, of red, amber, green. The red action, as ever, is an immediate referral to emergency care, either by ambulance or with the parents bringing them themselves, whilst the amber action is a further review in primary care, either face-to-face or by video. Those patients without amber or red features can be safety netted using the resource I'll show you shortly. Let's think about some of the factors that would make you high risk. In the colour and activity tab, blue or grey, the inability to rouse the patient, or if the patient is woken, don't stay awake, or concerns about the nature of the cry in the baby. Some amber features around colour and activity might include pallor, a reduced response to social cues, requirement of prolonged stimulation to wake them, or a young infant not feeding. We always think about respiratory, even in earache, because things can be linked together. And if you are able to get an assessment of the respiratory rate with the parent counting it, or by video assessment, please use this now. Also ask about what their breathing looks like. Does it look laboured or difficult? If it looks very laboured or difficult, or you can hear grunting, they should be seen in hospital. If it's mild or moderate increased respiratory distress, primary care will be fine for them. Thinking about circulation, do they have cold hands or feet in the absence of fever, or perhaps they're not weeing as much or not tolerating fluids? Again, these patients need a review in primary care. Finally, there are a few features that we would ask you to look for before deciding whether they're red or not. Young babies who are hot, with temperature greater than 38, any sign of meningism, so severe headache, neck stiffness, or not wanting the light, or a seizure, please send these children to hospital. Otherwise, a few more amber features to look out for that might make it more likely that this child would benefit from antibiotics. So pus discharging from their ear, suggesting a perforated eardrum, perhaps pain so bad waking them from sleep, a child under 2 who has pain in both ears, or swelling or redness behind the ear, perhaps they're dizzy, or they're a baby who has temperature more than 39 and is 3 to 6 months old, prolonged fever, or any child in whom there are additional parent or carer concerns. Again, please do try and arrange a prompt review in primary care, and if you can't, refer them on to hospital. In the absence of red or amber features, again, it's time for a safety netting advice sheet. And this is the earache safety netting advice sheet. See here, red, amber, green for the parents, some additional information at the bottom. To share this with the family, green button for SMS share. Pop the phone number in this box, share, and you're all done. I hope that was a useful video. We look forward to welcoming you back soon.